Podcast. I'm Dr. Millicent Rovelo, and I am here today with my increasingly svelte co-host, Dr. J. Calvert. Doctor?
I am definitely going that direction. Thank God.
Thanks goodness we have a Equinox right down the street.
And I am eating less and moving more, which is the recommendation of Jillian Michaels.
Yes, that is the key of just about every fitness instructor and doctor out there. And the reason this is important is because the topic of today's podcast is weight and obesity as it relates to plastic surgery.
It's very relevant.
Very relevant and a bit of a sensitive topic. And it's sensitive because obviously you don't want to upset anyone or make someone have to think about their weight because that can be upsetting. But at the same time, weight has a very real consequence and has potential for very real outcomes and complications in plastic surgery. And it's something that we do have to address.
Well, we do because a lot of times there are issues related to obesity that bring people to the plastic surgeon.
Right. And that is part and parcel of it. So there are issues related to the safety of surgery, of plastic surgery in increasingly high BMIs. There's the issue of complications that arise in patients that have elevated BMIs. And then there's the issue of aesthetic outcomes in patients with elevated BMIs. And I think it's important to sort of go through all of those. So the most, common thing I get and that we sort of have to go through is a patient that comes with an elevated BMI. Let's go through the BMI system real quick.
Right. This is an important thing because BMI it's used by doctors, by insurance companies, by fitness instructors. BMI is a very useful, although I think it's flawed. It's a useful measurement to start from. And the way that you calculate BMI is through it stands for body mass index, and it's your weight and your height.
It's height and weight
kind of compared to each other. So if you are 5'10" like me and you weigh 190 pounds, you are actually overweight. And thank you for playing. I'm just going to put that out there now. So, yep, that's right here. That makes you overweight. My BMI is 26. 25 would be normal. In fact, my doctor has told me she'd like me to weigh 160 pounds.
That's too small. You would just I wouldn't even be able to see you on this couch. I'd be like, Dr. Calvert, where are you? Where are you?
I think I would be dead. Actually, I think of 160, I would be just not viable.
Right. And so there's interplay with the numbers, but in general, quote, normal weight is a BMI of 20 to 25. Anything over 25 is considered overweight. Anything over 30 is obese. Anything over 35 is morbidly obese. Then over 40, it's super obese. And then there's super massive obese. So there are different increasing labels for it. But by definition, over 25 is overweight. Over 30 is considered obese. And so those terms don't really matter too much, but the numbers kind of do. And so when someone comes in with a BMI of 39, 40, 41, and they say they want liposuction or they want a tummy tuck because they want to be smaller, reasonable. I mean, I get it. But the thing I have to tell them is that plastic surgery is not a weight loss solution.
No, you don't get skinny from plastic surgery. You don't get skinny from
doing plastic surgery. Body contouring, tummy tucks, all of those things, even liposuction, are really designed to sort of complement weight loss. They're designed to fine-tune areas that are prone to gaining weight as opposed to other areas. They're designed to remove excess skin after babies, after weight loss, things like that. They're not designed to remove weight off of you necessarily. That being said, I do have some patients who say, well, I'm never going to lose weight. This is the size I am. I've tried and tried and tried, and this is the best I can do. And then we have a very honest conversation about, well, what can we do? And it's going to take a lot of stages. So I have some patients where I've done a couple of rounds of liposuction on them, and now we're ready for a tummy tuck because now I've reduced the size of you to a degree that I can do a tummy tuck. But it takes a lot of work and a lot of effort, and that patient right out of the door is not a tummy tuck patient. No. So the expectations have to be there about what plastic surgery can and can't do for someone that has too much weight on their bodies. And then the other question that comes up with someone that's very